All right, good afternoon, everyone. I'm going to give folks a second here to finish joining, and then we'll get started. Thanks for joining, everyone. Let me pull up my slides, and then we'll get started. All righty. Well, welcome in, everyone, to this panel processor training. My name is Kevin Phillip, and I'm joined today by my colleague Sean, who's going to help answer some questions. Um, and um, we're hopeful that most of you know what the panel processor is, but if you are brand new to this tool, hopefully this will give you a good overview or refresher, and you can walk away with a strong foundation of how you can use this to enhance your use of CRISP tools. Before I jump into the main content materials for today's session, I did want to remind folks of some housekeeping items. We have about an hour today. I don't expect the materials to go that long, and we should have plenty of time for questions at the end. However, if you do have questions during the session, as I'm going through a certain slide, you can drop them in the Q&A feature. Sean may answer them, or if not, we can answer them at the end. Try to keep the questions, if you can, more generalizable to the rest of the group here. If you ask something specific about why your panel isn't loading, I don't think that's something that we could answer on the call today without knowing the specifics of your account. But if you want to ask something about the tool or something broad about CRISP in general, we're happy to take those questions. If you do have a very specific question germane to your account, feel free to reach out to us, though. We're happy to answer that offline. We have the ability to pull up more information about what your organization has going on. We will record this session and we'll share the slide deck and recording with all attendees today so you can review them at a later date and then also share them with any colleagues who couldn't join live today. Um, so I think that's everything I wanted to get through with the background. So I'll start here kind of talking broadly about what panels are, since it's a little bit of a nebulous term and there's some other terms that we also use interchangeably with panels. So I just want to make sure that folks have a good idea of what panels are and why they're important to our organization. So put simply, panels is a list of patients your organization has a treatment relationship with. These are usually pulled from your electronic medical record for the past 18 months, and you can think of it as your active roster of patients. Panels are really important because they power many of CRISP's core services. By uploading a panel through Panel Processor, you make it easy to receive timely notifications, search patients in the CRISP portal, and support care coordination without having to break glass each time. Panels allow CRISP to know which patients you are responsible for, so we can deliver alerts and insights that are relevant for your population. This makes workflow smoother across all CRISP tools and ensure you're getting the right information all the time. So in short, panels connect your patients to CRISP services, enabling notifications, patient search, and more efficient care coordination. There are a couple different ways in which organizations can submit panels to CRISP. Um, One way is through integration. We call these type of panels auto subscription panels. Essentially, what happens here is we connect to your EMR and basically can pull down your active patients in a format that allows us to submit that panel, and it can be refreshed kind of automatically. The other way is a more manual approach that we'll cover in the rest of this presentation through the panel processor. The panel processor is a tool that we built through the CRISP portal and allows you to submit the panel of patients in a pretty seamless interface. And after the next couple of slides, I'll jump into that tool and kind of give you a walkthrough of what that looks like. Some other questions about panels you might be wondering, do panels expire? Yes, panels do expire. Typically, they expire after 2 years, but some programs, they expire after 90 days. Please check with your outreach representative to establish what your panel expiration date is. What happens when panels expire? When panels expire, you lose access. You will lose access to look up those patients in clinical records without breaking glass. You'll still have access to the prescription drug monitoring program if you are a user of that. How often should I upload a panel? Ultimately, this is up to you, but we recommend a upload of a new panel quarterly or every 90 days. But if you are a new practice and getting new patients frequently, you can upload it sooner, or if you want, you can upload it every 2 years. So it kind of depends on your process, but in the next session here, I'll talk about why panels matter and why it's important to keep them as up to date as possible. So I kind of alluded to this earlier, but the main kind of core function or one of the core functions of panels is to support our CRISP event notification delivery. And so this helps deliver real-time customizable health event alerts to keep care teams connected to their patients in the most important encounters and risks. So essentially what we do is when you send us your panel, we establish that these patients are part of your active roster that you have a treatment relationship with. We run that through our master patient index and kind of set that aside, and we know that your organization is responsible for these patients. And then whenever we get a data trigger from all of the other data feeds that we collect as the Health Information Exchange for Maryland, that tells us that one of those patients had an encounter or they had a preventable service event, such as a colonoscopy, and we have those results. Essentially, what we can do is send the event alerts through our send system. Folks who are accessing these alerts have two methods of accessing it. One is through a file share system or MFT, or the more common way that folks will access these alerts are through Population Explorer, which is a widget within the CRISP portal. So essentially, panels empower this whole system to work, and without panels, we wouldn't be able to send alerts when your patients have an encounter or another event, a health event that you should be aware of. The other main reason why panels are important is they empower patient search freely within the CRISP portal. So what you're seeing here on the screen is a screenshot of the CRISP portal, and you can see the main section there is the ability to search for patients. If you have provided us a patient panel and you're searching for patients and that patient that you're searching for is on your panel, you can easily open their patient record in the various applications within your dashboard that you have access to through CRISP. This includes things like the In Context app, which is what the app that empowers you to look at all of the data that CRISP has on a patient. If you don't have that patient on a panel and you're searching for them, you are required to provide a reason why you're searching for the patient. We call this breaking glass. So essentially, when you search for a patient who's not on your panel and you try to access their record, the system's going to ask you for a valid reason of why you're doing this so we can audit that search at a later date. Obviously, to stay compliant with HIPAA and the various regulations that protect patient data. Um, so to streamline you being able to search for patients, the patient panel helps empower that. Obviously, there's still probably valid reasons for you to search for individuals who are outside of your patient panel, especially if they are a new patient at your clinic who came in that you don't have on your panel yet. But to give you a sense of why panels are important, this is one of the core functions here. All right, so I mentioned the majority of folks sending panels manually will do it through the panel processor. Typically, organizations submit one panel that has all of their patients, active patients on it. However, there are situations where organizations might have multiple panels. Each of them are kind of each of them have a unique panel code that go alongside with them. Um, and if you are an organization that has multiple panels, um, obviously you should be aware of that. But for the most part, organizations will just have one panel that they're submitting through the processor. A little bit about Panel Processor. It's an application that allows users to upload panels into CRISP. The application allows users to upload panels for various services like Send. There's some other use case of why you might submit a panel. Panels are a list of rosters or patients of whom your organization has a treatment relationship with. And a little bit more about Send. It is a service that enables subscribers to receive real-time alerts when patients on their panel have a hospital encounter or other medical events. You can learn more about or sign up for the Send service by visiting our CRISP website. How do you access the panel processor? So if you have this asset and you are able to access the panel processor, you would do so through the CRISP portal. Once you log in, you would find the panel processor within your dashboard. And then once you click the panel processor card from your dashboard, it will launch the application. And a reminder that your dashboard will consist of all the services that you have access to, and each service displays on a card. There's actually, I don't know if you can see it well, but um, right next to your dashboard, there is like a gear icon or a symbol that you can click, and you can actually open up and change the order of which your cards appear. And if you are a frequent user of the panel processor, it might be a good idea to move the panel processor to the top of the card list, and therefore you can kind of see it right away when you log into the portal. Any changes that you make that you save with those settings could be sticky. So therefore, what that means is essentially the next time you log in, it will be exactly the way you left it. Um, so next time you're in the portal, check that setting button out and you can customize the way your cards appear. The other thing I'll say, just briefly, kind of off topic about the portal, some of the applications that you have access to won't appear until you perform patient search. For example, the in-context tile doesn't show up until you perform patient search because that application requires a patient record to access data there. So just keep that in mind when you're looking at your dashboard without having performed patient search on the home screen. So what does it look like once you open up Panel Processor? So once you click Panel Processor, the application will display within an iframe with the reports and applications toolbar on the left side, and then the panel processor brought up in the main kind of section for you to see. You can expand or collapse the sidebar by using that arrow that's circled in red on the screen. Um, and this allows you a little bit more real estate when you're looking at the tool that you're operating, in this case, the panel processor. Once you have the panel processor open, essentially there are two tabs. The first is upload file and upload history. The upload file tab is where users can submit a panel following the prompts that I will go over in a second. And then the second tab, the upload history tab, is where you can actually see the results of previous uploads that you have performed. I want to talk a little bit about templates. When you're uploading a file into Panel Processor, the first question that the system will ask you is to select your template and allow you to download the template that you are required to use. Most folks will use the send patient panel because this is the one that kind of power send allows us to have a patient panel and allows you to search for patients without breaking glass. There are a few other edge use cases for different templates that we have. For example, some of the other HIEs that we are partnered with have their own specific panel for some reasons. In Maryland, there is a panel type called reporting only panel that some folks might see. This type of panel is connected to some of the reports that are in the CRIS reporting services. I'm happy to kind of go over that if that is of interest to you in more detail if you want to reach out to me. But most folks here will only use the send patient panel, so that's the one I'm going to focus on here. But essentially, once you have the template selected, you are able to download that template if you already don't have that on hand. The other thing to keep in mind about the download is when you download the file and you fill out the file, you must save the file in a CSV format before you upload it. The system will remind you of that, but just for your reference as well, CSV file format is the one that we take when uploading a panel. So once you download the file, this is not what it will look like. It will look like an Excel file with the column headers at the very top going across the screen. And then in the rows is where you'll actually fill out the information for your patients. This chart here is just giving you a sense of what the field names are, what's required, and then an example of what the information that you fill out there will look like. So anything that's marked with a red X is required. Everything else is optional. You might be asking why even have optional fields if only the Xed information there on the screen is required. A lot of these extra fields we are able to store on your patient and then place in their patient record for when you are looking up data in some of our other applications. For example, it's not shown on this screen, but on this next screen here, you'll see things like care program or risk score. And if you do have this information and you do want to use this information, it can be a great thing to filter on when you're looking at Population Explorer in the future, for example. Help you quantify which patients are at most risk or are part of certain care programs that you should look at. Other pieces of information like PCP, insurance, things of that nature, we might use in the care coordination tabs of the InContext app to give folks a better sense of who is part of these patients' care teams. So keep that in mind for the optional fields. They're there to help better support your use of CRISP tools for these patients in the future, and also help any other organization that might have that patient also on their panel. Because we know patients just don't go to one place to receive healthcare. I'm not going to go through all of these fields individually, but I just wanted to give you a sense of what is available for you to send on your panel. The other thing that I will keep in mind for folks is you can use this section to send a care alert. We have more information about care alerts on our um, website and what you um, should think about sending in the care alert field, and what kind of information we're looking for there. Essentially, we want this information to kind of be timeless across the lifespan of the patient, and something that folks should keep in mind um, about the individual that we can show in our applications. So if you have questions about care alerts, a website is a good place to go for more information. The other thing that the system will point out to you, but I want to point out to you now, when you are saving your file, obviously it needs to be in a CSV format. The other thing that we ask is for the file name to be in a very specific format. I'm sorry, I clicked away. On the right side of the screen, you'll see kind of this long looking gibberish type pieces of information here, but essentially this is the file format that we ask all of these files to be saved in. So we ask you to use your subscriber code, which is the unique code that signifies your panel for your organization. The number 1 with some slashes and Z, and then the date in which you are uploading the panel. For example, if send_demo was your subscriber code, you would put that /1/Z/ and then the date that you uploaded that panel into the panel processor. Again, the system will remind you of that, so you can see that on the screen before you hit upload, but just so folks are aware, save in a CSV and then name the file in this specific format. All right, so to continue on in submitting a panel in the panel processor, we first must select a template, which we already did. And then the second thing the system will ask you for is to select which panel you would like to upload this panel for. Most organizations, like I mentioned before, will have one panel that they're uploading, and therefore they might have one selection in the dropdown. But some individuals might have multiple panels, so it's important that you select the correct one, as you don't want to overwrite the wrong one in your selection. If you don't have any panels available to you, you will see this error message on the screen on the right, basically asking you to reach out to our support team so that we can troubleshoot and look into your account and make sure your access is set up correct to send in a panel. If you do have the option to select a panel, you will see this successful panel selection with the reminders that I kind of mentioned in terms of CSV and the file naming convention. The other note there is that this panel you will submit will fully overwrite your existing panel, so please carefully review your file before you upload. And then once you continue, essentially you will be allowed to click or drag and drop your file that you have saved and fill it out into the gray box area. And then the system will process your file. There's a couple things that the system does in this step. Um, so the first thing the panel will do is process the file. The processor will check to validate that the file type and the file size is okay. A second thing it will do is scan for any viruses. The third thing it will do is validate the file. So the processor will confirm that the data within the file are correct to the template specifications. For example, it will look to make sure that in the date field, everything is filled out in the date format, for example, and make sure that all of your required fields are filled out for every patient row that you gave back. If a file fails this step, users can review the error details in the upload history tab. Even if one row fails out of the 100 rows, the whole file will fail this process. By uploading a panel, the system will automatically do these kind of checks. If you have no errors here, it will pass to upload for final validation, and the processor will send the file to the correct database location within CRISP to ensure that the panel is updated for your organization in the correct database. One other thing to keep in mind is a few months ago, we did change some of the fields that we were using in the panel processor. We've uploaded that in the current panel template that's within the tool. However, folks might have already had like systems built out to pull down information from their EHR into a specific uh, file that had the old headers there. We actually have a step in place that even if you have the old headers, essentially what the system will do in validation is ask you just to swap those fields out by hitting a few buttons in the validating file step. But just to keep that in mind that folks should be using the new template when they are trying to send in, so you don't have to do this extra step. However, if you have systems built out in place that you don't want to change, the old headers will work, but it require one extra step from the system to get the panel processed correctly. Those 5 steps that I kind of talked about, you will see the system kind of go through and give you a check if it has completed that step and also if it has failed that step. So the validating file step is the most common, in which folks may fail if information in your file is not complete correctly, i.e. there are fields not filled out that are required, for example. And then you can see the errors there in the upload history. So by clicking the records here, you can see what information failed, what you need to fix. And then here will also tell you the file status. So if the panel has been successfully uploaded, you'll get a message there. If it's in the queue, it might say not started, or if it's awaiting a validation from a team member, it might say that as well. The status will show error if there were any errors in the validation process in terms of setting up and sending in your panel. And that's kind of basically it for the panel processor. I know that was a lot of information, and I'm sure folks have some questions. One additional place I'll point you to that we have resources is our website, our public website, chrishealth.org. You can go there, and we have pages dedicated to panel processor, but some of the other tools that I mentioned that folks can use to access other CRISP data. So feel free to check that out. We also have our user guides and our one-pagers and our videos posted there on the various pages. So you can find those easily there. And then our support line is support@crisphealth.org, or you can call us at 877-952-7477. And now I will open it up to any questions that folks have. The first one I see here, will these slides be available for use later? Yes. So we'll send out the slide deck and the recording to the session so that you can take a look at these afterwards. And I should be able to get those out to attendees no later than this afternoon. Um, you mentioned being able to get notifications. How do we do that? So I would start by reaching out to your account representative if you um, are, if you know who that is. If you don't, you can reach out to our support line. They may connect you to the HIA administrator at your organization if you aren't that person for your organization. And then we can help you get connected to getting notifications for your organization if that is available. After a panel has been uploaded, is it available in other programs for other users to use? So yeah, so once you upload a panel, if it is like the primary panel for your organization, um, and it is uploaded within our system, yes, like other tools that use the panel information that they have access to, um, they will be able to start seeing alerts and search for those patients uh, for your organization. The only part where it's a little bit tricky, we might have to set up some additional access on the back end, is if this is panel number 2 or 3 or 4 for your organization. I just don't want to blanket say that like most users would have access to that if that's something set up for a very specific purpose. But generally, if a user at your organization has access to tools that touch panels, for example, the InContext app or the Population Explorer, and you're overriding the main panel that's used by your organization, that will downstream flow to the tools that uh, those users are touching. So hopefully I answered that clearly, if it even if it was a little bit long-winded. How do you go about creating a new panel for a defined set of patients participating in an improvement program? Yeah, it's a great question. So I would reach out to our support staff or your CRISP outreach representative who can help go about setting up that process for you. We might just ask some questions about, what you're trying to do with this panel, the correct course of action for you to take. Because we do know that there are some reasons why a set of users would have access to a specific subset of your patient panel, for example, or use that within some of the downstream tools that I talked about, or CRISP reports, for example. So they can help start the conversation about if this makes sense, and then if it does make sense, they can help you guide the steps that would be needed to take to set this up. On your end, it shouldn't be much other than having the panel ready, but if there is any other information that's needed, they can have that conversation with you. So in short, I would reach out to us if this is something that you want to do. I appreciate these questions. They've been great. We'll give another minute or two for more questions. And then if there are none, I'll give you some time back of your day. But we do appreciate you guys joining. And hopefully this gave you a better understanding. So give a couple more minutes for questions. Alrighty, seeing no other questions, I can go ahead and conclude this presentation today. We do appreciate you joining, and feel free to reach out to us outside of this if you do have any more questions that come up later. Slide deck that I will send by email later today. Thank you all and have a great rest.